Lee Culp, it is such an honor and a pleasure to have you here on Thrive Live 2021. You've been a name in dental technology for years, and I'm so honored to talk to you about the new trends and new technologies that are now pervasive in our industry.
Yep, great.
Yeah, thank you so much for being here.
Yeah, I'm grateful to be asked to be here with you, Jonathan, and also to really thank Henry Schein and Zahn, which Zahn supports me in everything I do. So it's wonderful of them to be able to put this together, and I look forward to spending the next half an hour with you.
Amazing, amazing. So here's my first question for you that pops into my head, which is a question that I ask with a number of my colleagues that have taken a very deep dive in the digital workflow and digital dentistry.
Sure.
Will the digital dentistry and digital technology make you a great dentist?
Absolutely not. You will just be able to be more efficient being bad. So the thing is, people think that it's going to change, it's going to make a technician better, it's going to make a dentist better. It doesn't. But what it does do for a dentist and a technician is really give you the opportunity to see. So it gives you great opportunity for the potential of being a lot better, because with digital, we can see things 1,000 times bigger than they were before. So there's no real excuse for a bad impression any longer.
Right. So the fundamentals of what we do, from diagnostics to visualizing where we can go with any clinical situation,
right,
to how we're going to get there, the fundamentals are not going to change.
No, not
right? But the efficiency, the effectiveness, as it relates to natural restorations, as it relates to supernatural looks, that gets changed, doesn't it?
Of course. So the cool thing, and that's why I was so excited to be on today with you, Jonathan, is really just to let people know what can go on. But our laboratory has kind of evolved from a place that makes things, which we still do, and we enjoy making things. But we do as much diagnostic work now, because we can do orthodontic surgery, we can do implant surgery, we can do perio, we can do ortho. And no, I'm not any of those, but I've learned enough. At least you can send me the data, I can do the heavy lifting. And then the teamwork approach between the general dentist, periodontist, orthodontist, laboratory technician, oral surgeon is incredible, because I am going to build you a digital patient. I'm going to build a digital patient, full head, smile, bones, put it on a digital articulator, and then we can see problems that we would have never seen before, saying just a single implant, looking at it and going, okay, if we move the tooth next to it, it makes this one so much more successful. So we do a lot of diagnostics just to look at the total patient health, like you were just talking about.
Listening to you, Lee, the only thing I can think about is the future is here. So
it's definitely here.
The future is here. And so as an individual clinician, even if I'm in with a team and we have about 25 people,
yep,
I would need to have an extremely sophisticated digital ecosystem focused just on that to be able to do it. Right. So what your company and what your laboratory is doing is enabling the restorative dentistry and their teammates, the other disciplines, to be able to diagnose much more effectively.
Yes.
And then to work with precision. So here's the question: what would I need to do as a restorative dentist from an information gathering standpoint to be able to send to you so that we can coordinate our cases in the fashion that you just described?
So there's 3 basic sets, depending on how complex we're going to get. So we were one of the first people, along with others, to approach the company Bellis 3D. So Bellis 3D is a company that kind of tied on to facial recognition software that Apple gave us with the iPhone and iPad 11. So they tagged on to that. So right now, I never put in a password. I look at my phone, it knows my face. So they took face scanning, which I've been looking at for a long time, but it's been incredibly expensive. And if I buy it, then you don't have it. And I actually need you to have that technology, not me. So again, I don't know the exact price, but for $400 or $500, you can have 3D facial scanning on an iPhone or an iPad Pro. So that's one set of data. The next set of data would be the intraoral scan. With all the myriad of scans that are out there, we can take all those in. And the third one, depending on if we are going to get into implant or surgery, is the CT scan. With those three data sets, I can build you a three-dimensional patient on my screen, and then I can do anything you could possibly conceive of: moving gums, moving teeth, restoring, doing surgery, doing implants, and I can, working with you, plan everything out, kind of pre-warn you some of the challenges you'll see, and restore the patient before you ever touch the patient.
Yes. So that's amazing. I'm a big believer because of my training, prosthodontics and Panky and Peter Dawson, of identifying the problems. And 25 years ago, and we published it in a number of places, in aesthetic evaluation form.
Right.
Is it helpful for the aesthetic dentist, prosthodontist, restorative dentist to figure out incisal edge position, length of, let's say, the central incisor, chair side, to give you a little more information as you develop your planning, your 3D in the face, in the occlusion, so you have this both integration of aesthetics and function?
Absolutely. So what that gives me, I mean, there's no such thing as too much information. So I like lots of information because it gives me redundancies. So I always like to take my virtual patient and look at a 2D photo and go, okay, do the teeth look like they're in the same place? But I want redundancy. I want to know, do you want an 11 millimeter central? So all those things that we have been doing for the last 30, 40, 50 years, none of that goes away. Right. The digital technology is not a replacement for knowledge. We still need good knowledge to be able to do the things we do today. And I think that's where it gets misleading for a lot of people. Well, with digital, you don't need to know all that stuff anymore. Not true.
Yeah, I couldn't agree with you more. With the lip at rest, and you're a 40-year-old patient or a 50-year-old patient or a 60-year-old patient, every 10 years, the upper lip drops a millimeter.
Yep.
We always believe that the lip is where the lip is, where we're restoring. But today we work transdisciplinary. I have a plastic surgeon comes to our office, and we show the patient 3D also, and I'm familiar with the Bella system, of what the smile will look like if we did a lip lift. Is it necessary? Right. So the disciplines can work together, but digital planning gives us so much more power for visualization to preempt where we're going, to avoid mistakes later, and to diagnose early.
Yes.
It changes the game. So,
totally.
Lee, let me go to the next question, because it's so obvious that we are living the future today, and it's a very exciting future as we cast out a little bit. Why do you think it is that even dental schools, faculty, and dentists, they're still resistant to getting out of the comfort zone? They're still resistant to this newness of this digital world that does help amplify what we do and make us so much more effective. What is your thinking and your understanding of that? And how maybe can we move the needle and help the profession amplify and accelerate forward?
Sure. Well, I've been digital as long as you can be digital. I mean, it's from day one. I was with CEREC during CEREC 3. I helped develop the CEREC lab system. So I've been doing this for a long time. Now, it used to be complicated. And we used to not necessarily get the best results. We got the best results we could get at the time. And you've got to evolve with that. But I think a lot of the thinking is still back then. It's actually very easy to learn, but everything keeps moving so quickly. You know, it's hard to keep up unless you're doing it on a daily basis. So we have seen the challenges that you've just talked about, but where we don't see the challenges is with dental students. They're all over this. I mean, they want it, they want to learn it. They're pushing their faculty and their schools to bring it in so they can learn it, because all you got to do is go on Facebook and see everything that's been doing. And if the school is not offering it, then this really going to be a problem in the future. I remember my daughter when she was at University of Florida. Gary went down to see her, and they were actually at my house in Florida. So we had the E4D scanner at the time, and Tamra, who was just kind of getting ready to go to dental school, I said, honey, go out and get something to scan. Go out on the beach and get some seashells. I've still got videos of her today scanning seashells with the first E4D. But things have gotten so much easier, and I think there's still that fear that it's complicated, it doesn't work, it's not going to give me the results that we need, and it's absolutely not true today.
Yeah, it's so true. And it is the young dentists that have embraced technology, that grew up in a very different world than many of us older folks that really accept it so well. I was very fortunate because I was very involved with Boston University, Goldman School, and chairman of the board there for a number of years, and very involved with the Dean Jeff Hutter, who in fact just retired. But they, under Jeff's leadership, and I'll use that word leadership, he moved Boston University forward, just like other dental schools, with the right leadership on top to inspire the rest of the faculty and give them a nudge and bring the young people into this game, because they are going to move us forward, won't they?
I agree.
Yeah, that's amazing. So let's go move 20 years forward, and let's cast out a little bit. Take me there and tell me, where do you think technology is going to go? Because we know in 20 years, you know, the early adopters, you know, it's going to pass already, and everybody's going to be scanning, and everybody is going to be able to be designing with digital ecosystems. But what's your take on what the future looks like?
Okay, well, so this is where I start to upset people. So I love reading. I've got a whole library of books on AI, just trying to keep up with what's going on in AI in the world today. So you just talked about people designing and people scanning and all that. I really think we won't be doing a whole lot in the future. The computers are already learning today where things go, and it's only going to increase. One of the factors, or one of the processes in dentistry that I think is the best candidate for going totally automated is actually digital dentures. So I was on the digital denture team with 3Shape and Ivoclar, and I was brought on the team because I had never done a denture in my life. I don't know how to do a denture. I still have no idea how to do a denture conventionally. I learned how to do a denture, not a master, but I learned how to do a denture in about 3 days digitally. But learning from my wife, again, one of my close friends, Dr. Lyndon Cooper at UIC, really learning about the geometry of the mouth, where things go, how things are so similar. That just seems one of the easiest things to do, because we're doing everything in the mouth, and a lot of denture is based on mathematics and anatomical landmarks and anatomy, that I think that one could go automated with AI very, very quickly. You were talking earlier with the radiologist, which I found fascinating. So I'm testing right now a cloud-based AI radiology software, because that's something we don't offer in our lab, is really reading that stuff. But it's an AI support system, and the AI will look at your CT scan and give you an evaluation on numerous things you can look at. So to not to keep going, but I think at least in the laboratory world, computers are going to be doing a lot of what we do. Printing is just started in what we can do today. We're still milling a lot of things, but once we get into printing, because everybody keeps going, well, you're never going to be able to print a crown, as beautiful as you can layer. Well, they said the same thing about solid zirconia about 10 years ago when it was just white and ugly, and zirconia has taken over the world. So I think printing, AI, reducing a lot of the things that are in the laboratory, but I think the laboratory will totally transition in 20 years.
Yes, yes. That's fantastic. And I couldn't agree with you more with looking out a little bit and looking at healthcare and looking at medicine and seeing where this exponential medicine is taking us. And dentistry usually just is a little bit slower, but we know that it's coming, and it's coming at us fast and furious, as they would say.
Yes.
So let's think about that 20, 30, 40 years from now, and there's a robot that's AI driven that is this phenomenal dentist, by the way. And you come in and they scan, and AI does all the diagnostics, and then we're 3D printing restorations. Is that AI robot going to replace us?
Well, we have no idea. But, and again, I love this conversation because I end up upsetting a whole lot of people. Yes, I think that robot is going to take over both clinically and in the laboratory, and patients will be seeing AI-driven robots, yes, and in the foreseeable future.
So we'll have an AI-driven robot, but when it comes to humanity, compassion, empathy, collating all that information, they're still going to need the human, aren't they?
Oh, no, of course. I mean, humans aren't going anywhere. I mean, when you look at technology and when you look at AI and you look at all these things, we evolve with the technology. I mean, it's been no different from the industrial age to the technological age to the digital age. We're still here. I haven't gone anywhere. You're still here. But I will evolve as the technology evolves. Don't know what I'll necessarily be doing in 15 to 20 years, but we'll still be here. Absolutely.
Absolutely. We know that. And AI is going to help amplify what we do and make us that much more efficient.
Right.
My last question, Lee, you have been supporting dentists in their field for decades. What is the future going to do for us from a communication standpoint so that your laboratory can't be in Florida and Texas physically, but because of our communication, our streaming, our advanced technologies, what's going to happen to our communication, that whole triad, communication triad between patient, the specialist, and our technologists, and so that we are a more effective team? What's the future hold for us?
So two things that you've said that I really wanted to jump on. The word exponential is one of my favorite words because humans tend to think linear, 1, 2, 3, 4, 5, 6, 7, where exponential jumps, just like when Bellis and Apple, those two things, that was 1 and 2, and we jumped to 15. So you have to think totally different about what's going to happen. But communication, and I've said this from the beginning. So when people talk about CAD/CAM digital, they think about machines that make something. And that's, what's CAD/CAM? Oh, it's you get a mill and it makes a tooth. But CAD/CAM and digital dentistry, and I've said since day one, is the ability to communicate like we've never communicated before. So I'm generally on my computer either designing or meeting with dentists or teams, restorative teams, periodontists, surgeons, orthodontists. That's what I do all day. And we're on my computer. I've built the patient. we're commuting, we're together as a team. So, I mean, it can't be any better. We're just like we're doing now, just like you and I are doing it right now, Jonathan. We're having some ultimate communication. But think about if the patient, the person we're caring for, is literally on the screen with us, and we're diagnosing, working. The orthodontist suggests something that might cause a problem with the surgery. The periodontist, might suggest something that might cause a problem with the restorative. But the teamwork that we're seeing, especially with surgeons, when we get a surgeon on the call with the restorative dentist, and I've kind of generally done the heavy lifting and laid everything out, and they see the restorations, the screw access holes, the challenges, what we could do, it's an amazing enlightenment for them that we can do things and do it so predictably. One of my other favorite words, I like simple, predictable things. And digital technology has allowed us to be able to do that so perfect today.
Yeah, and that's the magic word, is the planning and also the collaboration, where everybody is bringing their unique abilities together, and technology is going to help us build platforms we're there already, and it's only going to get better. To all of your points, Lee Culp, this has been amazing conversation. You are giving us a window into our future. Prosthodontist, aesthetic restorative dentist, and specialty teams.
Yes.
How much better we're going to work together when we embrace this new technology.
Yeah, absolutely. And it's here, it works, it's efficient and predictable, and I've never enjoyed dentistry more. Yeah.
Well, I got to tell you, I've also been at it 3 decades, and I say the same thing. And it's really a very exciting future. Well, Lee Culp, thank you so much for joining us for Thrive Live 2021. It's been an absolute honor and a pleasure to talk to you about what we have going today and what we have in the future.
Same here. Thank you very much.